Jaden. I'll be your student nurse today. Could you tell me your first, last name, and date of birth?
Jacob Kusko, 52696.
Okay, so I understand that you're here for a physical today.
Mm-hmm.
So we're just going to be doing a head-to-toe assessment of all of your systems and making sure that everything's right where we want it to be.
Okay.
Do you have any past medical history?
No.
Any past surgical history?
Nope.
Any family history?
Nope.
Any medication allergies?
No.
Okay, could you tell me who brought you here today?
I brought myself.
Could you tell me what month we are in?
November.
Okay, so the patient is alert and oriented times 4 and well appearing. Are you in any pain?
No.
Okay, patients, on a scale of 1 to 10, what would you say the pain is? Well, 0 to 10.
0 to 10?
Yeah.
1. 0.
Okay, you're perfect. At this point, I would take your vitals. All your vitals are within normal limits. Throughout this exam, I'm going to be looking at all of your skin for color, texture, temperature, and hydration.
Okay.
Before I start, do you have any questions?
No.
Are you in a comfortable position?
Yeah.
Okay, I'm going to start by just inspecting your head.
Okay.
Okay. I'm going to palpate.
Okay.
Okay. Do you have any headaches?
No.
Okay. No issues with like dizziness, forgetfulness?
No.
Okay, perfect. Head is normal cephalic and atraumatic. No lumps, bumps, bruises noted. No issues with tenderness, no pain upon palpation. So now I'm going to move to your face. Your face is symmetrical. Okay. I'm going to palpate your sinuses. Just let me know if anything is giving you any pain, pressure, or tenderness, okay?
Okay.
Any pain?
Mm-mm.
Okay, perfect. I'm going to palpate your ears now. Tell me if anything causes you any pain, pressure, or tenderness.
Okay.
Okay. Perfect. Can I have you smile for me? Can you frown? Can you puff out your cheeks? Okay, I'm going to have you open your mouth for me and close. Do you have any issues with any clicking?
No.
Any pulling there?
No.
No symptoms of Rambo. No symptoms of TMJ noted. Ears are symmetrical. I'm just going to look in your ears.
Okay.
No redness or drainage noted in the ears. Have you had any issues with like ringing in your ears?
Mm-hmm.
Okay, I'm going to take a look in your mouth. Uvula is midline. Tonsils are at a 1. Good oral hygiene. Oral buccal mucosa. Rambo. Oral buccal mucosa is pink and moist. I'm going to have you look straight at me, okay? Bright light. Sorry, look straight at me. Bright light. I'm going to have you look at my pen and then focus on my finger over here. And then back at my pen. And then back to my finger over here and back at my pen. Perla is noted. I'm going to have you follow my pen. EOMs are intact. Do you have any issues of eye drainage, itchy eyes?
Mm-mm.
Okay, sclera is white, conjunctiva is pink. I'm going to have you cover your nostril, breathe in, and then the other. Nares are patent. Do you have any issues with nosebleeds?
No.
Okay, do you have regular dental exams?
Yes.
Any dentures?
No.
Perfect. I'm going to have you look straight up for me. Look straight down. Can you look side to side for me? Does that cause you any pain?
No.
Full range of motion intact for head and neck. You walked in here today, so you have full range of motion of your upper and lower extremities. Perfect. Next, I'm going to test your sensation. Can you close your eyes for me? Just tell me where I'm feeling it and if it's sharp or dull.
Left cheek. Right arm. Left leg.
Perfect. Normally, I would do that test with a cotton ball and a sharp object, but we do not have those. So, next I'm going to move on to your neck.
Okay.
I'm going to examine your neck and palpate just like I was before. So right now I'm just going to palpate. Let me know if anything causes tenderness. I'm going to palpate for your lymph nodes, submental, submandibular, preauricular, postauricular, occipital, cervical. Can you shrug your shoulders for me? And then supraclavicular. No lymphadenopathy noted. Trachea is midline with no tracheal tug. I'm just going to check with my pen light for jugular vein distension. No JVD is noted. I'm going to palpate your carotids on both sides, one side at a time. Carotid pulse is a regular rate in 2+, bilaterally. Next, using the bell of my stethoscope, I'm going to listen to your carotid pulse. No bruit noted. Moving on, I'm going to move on to your chest.
Okay.
There's also no enlarged thyroid noted.
Okay.
Okay. So I'm just going to auscultate your breath sounds. The chest is expanding bilaterally. Starting from the second intercostal space, I'm just going to move down in a Z formation, checking 8 sites. I would listen to each of these on bare skin. Do you have any difficulties breathing? I'm just going to check the sides here. Do you have any difficulties breathing?
No.
Okay. I will listen to each of these for an entire respiratory cycle, meaning 1 inspiration and 1 expiration.
Okay.
Now while I have you sitting here, I'm going to listen to the back, starting from your cervical. I'm just going to hit 10 spots. 2, 3, 4, 5, 6, 7, 8, 9, 10. Do you have any issues with back pain?
No.
Okay. I would also test your skin for temperature, texture, and color. Your skin is pink, warm, dry, and intact. Perfect. Now we're going to move on to your heart. Do you have any issues with chest pain?
No.
Any difficulty lying down?
No.
Perfect. Using the diaphragm of my stethoscope, I'm going to mark out APTM. So we have your aortic, starting in your second intercostal space. Pulmonic, also in the second intercostal space. Erb's point in the third intercostal space. Tricuspid in the fourth. And mitral, which is also your apical pulse, in the 4th to 5th intercostal space at the mid-clavicular line. Apical pulse is a regular rate and rhythm. S1 and S2 noted. No murmurs noted. That's it.
Nice.
Okay. Now while I have you sitting here, I'm just going to do your upper arms.
Okay.
So I'm going to examine your upper arms for temperature, texture, and color. Skin is pink, warm, moist, and intact. No tenting is noted with turgor. I'm going to check your fingers for clubbing. There's no clubbing noted. Check your cap refill. Cap refill is less than 3 seconds. I'm going to check your brachial, radial, and ulnar pulses. All pulses are a regular rate and 2+ in strength. I'm going to have you bring your arms up for me, all the way up and all the way down. Perfect. Full range of motion is intact. I'm going to have you push against my hands. Can you pull my hands back? Okay. Can you push my hands in? Okay. Can you push them out? And then I'm going to have you grip both of my fingers. Grips are 5 out of 5 bilaterally. Strength is 5 out of 5 bilaterally. I'm also going to go through your lower extremities while we're here too. Actually, changed my mind. Can I have you lay down so I can examine your abdomen, please?
Yes.
Are you in a comfortable position?
Yes.
Okay. Do you have regular bowel movements?
Yes.
First, I'm going to inspect the abdomen for contour and symmetry. Your abdomen is symmetrical and the abdomen is flat. I'm then going to take the bell of my stethoscope and auscultate the 4 quadrants, starting in the right lower quadrant, to the right upper quadrant, to the left upper quadrant, to the left lower quadrant. Bowel sounds are active in all 4 quadrants. I'm going to lightly palpate your abdomen now. If you have any pain or tenderness, just let me know.
Okay.
Any pain?
No.
Okay. No pain or tenderness noted? Well, now we're going to move down to your lower extremities. I'm going to start by palpating your pulses.
Okay.
So we're going to start with your femoral pulse. your popliteal pulse, your posterior tibial pulse, and your dorsalis pedis pulse. I would inspect in between your toes, but I'm not going to touch your feet. And check cap refill. Cap refill is less than 3 seconds. I'm going to examine your skin. Skin is pink, warm, dry, and intact. Pulses are regular rate, 2+ strength. I'm going to have you push up against my arms. Push down. Push in. Push out. Strength is a 5+ of the lower extremities. And I believe that completes our assessment.
Okay.
Do you have any questions?
No, I don't.
Okay. I will now perform hand hygiene. And if you have anything, just let me know. The bed is in low position and the patient has their call light.